everybody. I'm Jennifer Palmer with Strachan Novak Insurance. I'm a senior healthcare advisor, which in a nutshell means I help people with their Medicare. So I'm coming to you today to give you a 5-minute overview of the basics of Medicare. So what is Medicare? Medicare is federal individual health insurance for eligible U.S. citizens and legal residents. It is actually funded in part by the taxes that you pay while you're working. Medicare is comprised of two parts. Part A is hospital insurance and Part B is medical coverage. Who is eligible for Medicare? You need to be over the age of 65, or there are two other situations where you can be eligible. One of which is if you are under 65 with a qualifying disability, and the second is if you are under 65 with a diagnosis of end-stage renal disease or ALS, also known as Lou Gehrig's disease. When it comes to applying for Medicare, I like to make sure people are aware that it is not necessary to take your Social Security or railroad retirement benefits to be able to start Medicare. However, if you are already receiving Social Security benefits or railroad retirement benefits prior to your 65th birthday, you will be automatically enrolled in Medicare Part A and Part B. Also, if you are receiving Social Security disability benefits for 24 months, then you will be automatically enrolled in Medicare Part A and Part B on your 25th month of disability. Now, if you are delaying collecting your Social Security or your railroad retirement benefits, you must enroll yourself in Medicare. And this must be done during the 7-month initial enrollment period. And this occurs 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. You can apply for Medicare at ssa.gov online, or you can contact your Social Security office and schedule an in-person appointment as well. A common question I get is whether everyone is required to sign up for Medicare Part A and B at age 65. And the short answer is no. If you are still working and you turn age 65 but plan to continue to work past the age of 65, whether you need to enroll in Medicare at the time depends on the size of your employer. If your employer has 20 or more employees and the employer health coverage is considered creditable, which most are, you may delay enrolling in Medicare without a penalty. However, if your employer has less than 20 employees, then you must enroll in Medicare Part A and Part B at age 65. Once you've signed up for Medicare Part A and B, you've done the first step in the process. But that is not enough coverage. You really need to have another option to accompany your Medicare Part A and Part B. And when it comes to the most common options, there are two you'll hear most about. One is a Medicare supplement policy. This is also known as a Medigap, and that is usually done with a separate prescription plan, which is also called a Part D plan. The other option is what's called a Medicare Advantage plan. You will also hear these referred to as Part C plans. And these usually contain the prescription drug coverage within the plan and also often have additional benefits such as dental and vision. These decisions to decide which policy that you will go with to accompany your A and B are made using factors such as your doctors, your medications, and it is crucial to have a trusted Medicare advisor to assist you in navigating these decisions, because this will help you to avoid late enrollment penalties that can occur if it's not done timely or correctly. So if you have questions about your Medicare or would like a review of your situation, please feel free to contact me. This Medicare maze can be very confusing, and I would be more than happy to help you navigate it. I always tell people when they're starting to think about Medicare or retirement, you can never call too early, because the key with this is planning. If you plan ahead, it will save you an enormous amount of stress and will also keep you from missing deadlines that can result in penalties. So if you are interested in meeting with me or want to do a review of your situation, feel free to give me a call or click the link below. I hope this was helpful, and take care.